and welcome to another episode of The Future Of. I'm Azam Farooqi with my co-host Vasie. Hey Vasie, how's it going?
Good. How are you? What a week it's been as well, huh?
Yeah, amazing, right? I mean, GameStop, and then we find out that our vaccination rollout wasn't accurate. There's a whole bunch of stuff going on.
A lot of news, a lot of news. I think I saw a meme somewhere where it said every Wednesday in January had some sort of historic event. And it was really accurate. Yeah, absolutely. But anyways, today we actually have a very special guest. And this episode, similar to one that we did last fall, is a little outside of the box. I know we tend to typically focus on future state topics, but given that we're in the midst of a pandemic, we're essentially in year 2 of a pandemic, we invited a doctor from the Greater Toronto area here who runs an emergency area. His name is Dr. Kashif Pirzada, and he was able to kindly give us about, I think, an hour of his time. Mm-hmm. And we had a wonderful discussion on a lot of topics. Was there anything that for you, I think, Azam, that really stood out in terms of the discussions we had?
I think it was very interesting because being an ER doctor and, having first-hand experience with COVID patients kind of gives you some real perspective, right? So it's a little bit different than what we got from Dr. Don Bowdish last time. This is more on the, the applied side where you're seeing the practical challenges that doctors have faced. And for me, the interesting thing was some of the tips, he talks about maintaining air quality even within your own home. And, he's optimistic about the vaccine rollout, although that was a week ago. And since then, we've learned some new stuff. So we can always go back to him and ask. But overall, no, I thought that was very interesting and quite optimistic. So I was happy we had a chance to sit down with him.
Yeah, and I think the interesting thing too, he was able to share, and you'll hear in the podcast, is that when we recorded the episode last Sunday, so that would have been January 24th, that was actually the first year anniversary of his first COVID case. He had a traveler from Wuhan in his emergency room, and that was what really started a lot of what we're seeing today and how we're reacting and sort of managing day to day now. And so without further ado, the episode is the future of the pandemic, I guess, or coronavirus. I'm not sure.
We'll call it the coronavirus special.
How's that, Matt? The coronavirus special. So please enjoy. Sure. Well, I was going to ask if Kashif wanted to do sort of just his experience so far.
Yeah, for sure. Yeah, that works.
A baby during the pandemic, lots of crazy stuff has happened. Mm-hmm. I know. So, okay.
Today, your listeners, I'm an emergency doctor. So today is an interesting anniversary. Today's the 24th, was the first time I saw a suspected COVID patient at my hospital. It was probably Canada's 3rd case. I had to shift right after where they found Canada's first case. So I was scared crapless. I had like all these staff ready to make sure I put on my garb correctly. And it was the last patient of my shift, and there's superstition in our field that the last chart you pick up is going to be the one that keeps you there for hours. And it said at the top, return traveler from Wuhan. And I was like, crap.
Wow.
It's real. It's finally real. So.
And at that point, so January 24th, it would have been 2020. At that point, did you in the medical profession here in Canada know a lot about COVID and what was going on? Or it was just sort of like, here's the first case, or in your case, it was here's the first patient who had it?
We had a little bit of warning. So we all got an email from actually Dave Williams, the Ontario Chief Medical Health Officer, on January 1st that there was a suspicious pneumonia from Wuhan. So we were all on alert. I think we were watching the news as well. So we were all, really, really on alert. I think the US had their first case a few days before us. So when it came, we applied what we learned from SARS, like isolate the patients, the type of gear you should wear was informed from that. So we thought that would contain it and that we could at least prepare for that. So we were getting ready for it, I think.
Wow. And so since then, so that's to your point, it's been a year. What's been your experience like so far? You're on the front lines, you're an emergency doctor at a local hospital here in the Toronto area. What's that been like?
It's been interesting. So starting from that point in January, at different hospitals where I work, we started getting ready, right? We started preparing staff, we started training people, we started setting up isolation areas. But the assumption was that we thought the government at the federal and provincial level was also doing the same preparations. But now we're learning that that wasn't the case. No one had provisioned the necessary N95 masks. No one was looking at travel restrictions, that kind of thing. So it was all kind of puzzling. And over time, we started seeing more and more desperate cries from help from different countries that were getting hit at different times. The one that really changed things, at least for us here, was when Italy got hit, and we saw like these really impassioned pleas from Italian intensive care doctors who were like pleading with people around the world to get ready for this. And that, I think, finally brought it home to a lot of the doctors here, when mostly it was just a few emergency doctors screaming into the void and not getting listened to. So at the same time, we were about to have our second baby, and he was due in the middle of March, and that's when really things hit the fan. So we go into the hospital to check in. It was as a planned C-section. Nobody really was aware. There was no precautions or anything. I would ask the nurses, "Are you afraid of this?" And they would be like, "Afraid of what?" So, but I brought Lysol wipes. I cleaned the whole room and didn't leave the room after the delivery. And then we ran straight home as soon as they discharged us, and that's when the whole state of emergency got declared. So it's been hectic. It was a slow process that came, and all of a sudden in March, that's when things got real. And then when patients started streaming in, we were on our guard. I don't think anyone in my group got sick from COVID, which was, to their credit. One nurse, I think, so far. And we handled the wave that came, the first wave. And now things have gotten a lot more serious again now. There was a lot of fear at the start because we were all scrambling to get equipment, especially N95 masks. That was a huge concern, and you saw a lot of people sort of fight for that. You saw groups like Conquer COVID came up along with people like Haley Wickenheiser and Ryan Reynolds. We organized that to sort of get PPE to the frontline people. And another failure that should never have happened at a high level. So initially there was a lot of fear. Now we're kind of used to it. With it as a day-to-day thing, but it's been a heck of a year, probably the craziest year of my career for sure, and many others, I'm sure.
So when you think back to it, when you got that third patient in Canada, was the assumption or expectation then that it is somewhat similar to SARS? So it's deadly, it's a cause of concern, but obviously nothing close to where we ended up being, right? And was it like Italy was the turning point where we figured, okay, this might be very different, and this might, impact everything a lot more than SARS did?
I think one thing was that it's this virus is not as deadly as SARS, and that's what I think threw
Correct.
people off. Like SARS killed 10% of the people it infected. COVID-19, SARS-2 kills maybe 1%, maybe 0.5%, but the others, there's a significant percentage that would die without hospital care beyond that. SARS was only transmitted when you had symptoms, whereas this one can transmit without symptoms. So that threw people off as well. So there was some understanding, but I think the lower death rate probably made people a bit more complacent. The images weren't as dramatic. The other thing with SARS was that we managed to keep it contained just to the hospitals in
Yes,
Toronto when
I
it
remember
hit
that.
here.
Yeah.
Exactly. So it didn't really touch the public. So they didn't have this. It was something that happened to other people. It wasn't something that happened to them. Other countries like in South Korea, Taiwan, and Hong Kong had it much worse. And they actually, I think that public was more primed to prepare for something like this because they had a much worse outbreak with the first SARS.
That's interesting because I remember during SARS time, I was in university and I was working at Tim Hortons. So it was a daily conversation between people, but uh, it really didn't impact your life. I would still take TDC and I would go and start my shift at 2 p.m.
Yeah.
And, there were a few things here and there, and a lot of it had to do with mostly, uh, you know, sometimes, xenophobic comments or stuff like that when stuff like that comes up but other than that, it really didn't impact your life as much, right? Um, but yeah, this was um, so when it hit in March. What I'm trying to understand is what was the trigger that governments or healthcare professionals realized, okay, this is where we need to go towards lockdown. We need to,
Mm.
like because even back then, like if I remember, and if I'm being honest, it was a little hard to understand what people are saying. So like where I worked, we had a case, and we had a medical doctor talking about stuff. We've heard a lot of experts, and even the stuff that experts said back then, it's a little bit different than what we know now. And I think that's been some of the challenge. So I'm just trying to understand, at what point did we realize that, okay, this has to move into that lockdown period?
I think, to be honest, when celebrities started getting it, like no one was listening to us, like in the emergency doctors, like our group, Canadian Association of Emergency Physicians, were lobbying to try to get heard. I managed to score a meeting with a senior cabinet minister, with a group of friends, through just crazy phone calling. And what we said to them, we laid down like the scenarios that were happening, and there was genuine shock on the other end. I think there was information wasn't going up to where it should have been. Like, I think our decision makers weren't properly informed. And then when it hit home, when I think the prime minister's wife got sick,
Yes.
that's when it became real for them. And that's when Tom Hanks got sick, and when the NHL shut down, when the NBA shut down. That's when it got real for most people, that this is something dangerous. What's happened in China already, which is a distant foreign land, which most people aren't aware of, I guess. And then even when Italy got hit, that still was too distant. But when it hit home like that to decision makers here, that's, I think, when it really crystallized for them.
Yeah. And how was it, to follow up on that, because you talked about the rate of infection for SARS was much higher than COVID. And so how were we able to sort of contain SARS back then, but we weren't able to sort of contain, I don't know about the rate of infection, but the infection of COVID? Like, what were the differences? I'm very curious.
So SARS was transmissible only when you had major symptoms, like when you were half dead, like, and coughing out your lungs, basically. COVID, you can transmit a lot even when you don't even have any symptoms at all. So it was much easier to contain SARS. And I'll tell you, a friend of mine saw a patient in a walk-in clinic and sent her to hospital, who ended up dying during SARS. And he was very lucky to have not gotten it, because he was right in front of her. He was wearing a mask, and sent her to the hospital. And he spotted one of the early cases of the second SARS outbreak that happened, if you remember that whole sequence of events. So she was very transmissible at that point. Whereas a COVID patient will transmit to their entire family and not even know they were infected.
Right. Okay. So now that, I mean, we're a year anniversary since sort of, we've had our first cases here in Canada. I guess the question for me is like, and then now we sort of, even us, as Azam and I, we kind of know how to live. We know what we need to do: mask, sanitizer, stay away, social distance. What do you feel are still some of the sort of the misinformation that Canadians have about the pandemic or COVID-19?
So I think there's always going to be that group of people who think it's fake and it's a conspiracy. And honestly, a lot of people like me have stopped trying to convince them. They're just never going to listen, really. There's a group of people who are skeptics, like, and that can be convinced. And those are the people that we work on. One thing is, we know that this virus is 5 to 10 times deadlier than the seasonal flu. It definitely hits older people, and people with certain conditions like blood pressure, cholesterol, diabetes, obesity, much more. So anyone who tells you that it's just like the flu, or this is all a conspiracy, it's not the flu. Like, people don't shut down the economy over something like the flu. This is much worse and needs much more greater care and attention. So that's one myth. The other thing is, there's a lot of myths around the vaccine that have come out, that it'll change your DNA. That's false. That it's not.
Sorry, that's a funny one. Okay, keep
I
going.
use this analogy, like I say, this vaccine, it's made from mRNA. It's like a Post-it note, right? It goes. Imagine if I put a Post-it note in a book. It stays there temporarily, but then I shake the book and it just disappears, and I throw the Post-it note out. It's very short-lived stuff. It doesn't change your DNA. And I remember I was a lab student when I was an undergrad, working on genetic stuff. And this mRNA vaccine stuff was science fiction. This was 20 years ago. And it's taken, decades of development to get it this far. We're very lucky to have this technology, because we're looking at Chinese vaccines that are made using older technology. They barely work. Like they're 50, 60% effective. So we're very lucky that we had the tools to make a vaccine that was this effective. So that's some of the conspiracy thinking. But honestly, it looks like from recent polling that most reasonable Canadians are on board, about 90% of the population. So I think hopefully that will bear out in the summer as we get people vaccinated.
So that's one thing I want to talk about. So let's put aside the anti-vaxxers or conspiracy theorists and like even skeptics, but like people who are following, all the rules, or at least doing their best, or even if they're not following, they acknowledge that this is going on. When we hear stuff in the media, sometimes it's policy experts, sometimes, like it seems like that the public can very easily get confused, right? Like if we go back to early days, the initial thinking was that masks may not necessarily be very effective against it. And, there was that communication that was made out, from the highest levels. And then suddenly do an about turn with, and for the right reasons at all times. There's no, nefarious reason behind it. It's just sometimes as you get to know more information, you're able to better make those decisions. But having said that, so over the period of time, people have heard a lot of different conflicting information, right? What are some of the misconceptions are you seeing on that standpoint? That, okay, do you get it from, let's, like, for example, we heard, like we mentioned just before we started recording, that Canada Post employees getting it. Can you get it like from a surface, like if you get mail, or is it just aerosols, or like how much is surface? Like we don't hear a lot more of it as much, and frankly, it becomes a little confusing for a day-to-day person as to how much. Like there's a very fine line between being careful and being paranoid, right?
Yeah.
How do you balance that?
I think we've all been crossing and back and forth across that line throughout this pandemic, right? Like, there is a lot of confusion. I think there is differences of opinion that occur among experts. There's also which experts do you elevate to the national level? Like we've seen, national media has brought infectious disease experts to the fore. Like everyone's a household name in those fields. But it's a very conservative specialty in medicine. These are doctors who usually tell us, the rest of us, how not to prescribe things, how to restrict the use of certain drugs that like antibiotics. And so for them, they're used to saying, avoid interventions and be more conservative about interventions. Whereas in my field, in emergency medicine and critical care, we're more, let's do everything we can. Let's be cautious. Let's take precautions. So there's genuinely a very big philosophical difference between us. Mix into that public health people who are government employees. They have more restrictions on what they can say and less scope. They're not independent. For me, like the government can't really fire me. Like they don't, I work independently in hospitals, so they have no control over what I say. But if you're a public health doctor, your salary, your meal ticket comes from government, so you're very limited. And there's evidence now, like that's come to light lately, that there's a lot of limits on what they've been saying. And in one case in Alberta, a public health doctor was fired by the government there when they were too outspoken about climate change. So there's big limits. There's different philosophies. Generally, I wish that more experts took on something called the precautionary principle, which is if an intervention is good, less cost, it's not too difficult to implement, like masks, and it may work, and there's some preliminary evidence that it works, then you should go ahead and do it, and then do the studies and see that it works. And I don't see the harm with that, and that's a big failure, I think, that we had.
So maybe just to expand upon that as well, what would you say now? I mean, in Ontario, we're in another sort of lockdown. What are the highest percentages, or I guess what is the most sort of dangerous ways in which you can transmit COVID?
So one thing that's interesting is that with this new variant, there's more evidence that COVID can spread in an airborne way. So what does that mean? The first SARS we knew was airborne. And I remember I was a medical student at the time. we wore an N95 mask for 4 months, every day, day in and day out. We weren't even allowed to touch the mask. That's how we beat SARS-1, basically. That's how we drove it out of our hospitals. Here comes another related virus. It wasn't thought to be airborne, but there's these super spreading events. Now, convincing sort of establishment thinking that, we need to take care and protect against the possibility that it's airborne, that's been a huge challenge. I helped a group of scientists and physicians and other experts write an open letter to try to convince policymakers. So how do you protect against an airborne virus? You make sure that you're not in the same room with someone else who may be infected when the circulation's bad. Imagine you're in a room with a smoker, right? If you can smell their smoke, then you could be getting virus from them. That's the analogy, basically. What does that mean for us? Those crowded lines you see at grocery stores, those need to be way more spaced out. You should have high capacity air filters everywhere in everyone's office if there's anyone in the rooms together. You need to bring things like, a CO2 monitor. So I've been monitoring, and my colleagues have been monitoring CO2 levels in every room that we work in to see what the levels are. And that tells you how fresh the air is. Is the room being cycled out enough? You'll find that many of the worst nursing home outbreaks were in places with really poor ventilation, especially the really old homes in Quebec where 100% of the residents were infected. And I'm sure if you look at some of the outbreaks now, we've been trying to get people into the homes to test it, that ventilation would be a factor. So I think for now, what everyone should be aware of is that this virus can be airborne. Just be careful. If you can, do delivery or pick up for your groceries, and just wait out a few more months. The vaccines are coming in huge numbers soon. All you have to do is wait a couple more months, and then we're going to get 1 million of these shots a week. And even one shot can protect you a little bit, even a major bit from serious illness. So we just have to go through a few more months of this, and then hopefully we'll be in the clear soon.
Okay, so this is a good segue about the vaccine rollout. What are your thoughts on how the governments in Canada have managed the vaccine rollout, operationalize it? Because right now, and I'm glad to hear that you're saying that we'll have the capacity to do millions, soon. But right now, it seems that we're not even doing 50,000 a day, right? Like we're pretty on the lower side, not even 2% of the population has been tested. A lot of it may have to do with the actual deliveries and stuff. What do you think about the rollout strategy so far?
So the strategy of the federal government has been very interesting. They keep saying that we've bought 500 million doses from 7 companies, but problem is that one of them is a dud. The Sanofi GSK one is, no one knows when it's coming. One of them is from a company that's never delivered a vaccine before, Novavax. The Medicago one, which is a Quebec company with I think Philip Morris or other tobacco companies, it's a new technology no one tested before. So that's 3 down. The 4th one, AstraZeneca, has had some interesting problems with its data, but that's coming. But the 3 great ones, Pfizer, Moderna, Johnson & Johnson, are coming in big numbers in the spring. So I think what's interesting about that is that some countries managed to get more access to it, like the UK, the US, Israel, and other countries, by paying more and by promising the companies access to data. If we were savvier, we could have made the same deal with drug companies. But our health systems aren't up to snuff to provide the data they needed. And we just didn't negotiate well enough, I guess. So that's one thing. The other thing is logistics of a vaccine rollout. What we're seeing, the most successful countries like Israel, Bahrain, even the UK now, which is vaccinating, I think they vaccinated 600,000, 6 million people so far. So like 15% of the population. Is that you need to do a wartime mass mobilization. So you need like arenas, we have one convention center in Ontario set up, but you need arenas, you need parking lots, you need to start training volunteers. So we need to start to see this activity because, if we're getting 1 million shots a week in March, April, we need to have the bodies on the ground to do that. So I'd like to see more of that kind of preparation and more, at least the government telling us what they're doing to prepare.
No, that's a good point. So, because from a communication standpoint, because Vasie and I were talking, so I work in operations, right? So for me, it's always interesting. I see whenever we talk about any rollout or any initiative, like what does operations look like? Because it's frankly, I mean, it has a lot of challenges, and they're very minutiae, like small things that could become a bottleneck and things like that. And knowing in Canada we have like a 5 or 6 urban centers, and the rest of the population is very dispersed. We get that challenges with Pfizer vaccine, with the temperature that it requires and things like that. But we're talking that we haven't seen a lot of communication from government. So I know a couple of people in UK, they mentioned that they got a text message saying, "Do not come inquire about vaccine. You'll be notified when you'll be up for it," and things like that. Like, we haven't heard anything. It's like we're sitting in dark, right? And it kind of makes, and from that standpoint, you can understand the public is like, okay, 2 months, 3 months, like there's no discussion, right? We'd say that September, but the pace at which we're going right now, obviously that September is not a hard deadline. So if all these vaccines are coming, why do you think that there's not like such crystal clear communication about that?
And can I also add to that too? Also, given these sort of logistical challenges, and I guess the production and which ones we know are effective and have been proven to be effective, like, do you think we'll meet this September 2021 target that, to Azam's point, that's the only timeline that I'm aware of as to when most of the population is supposed to be vaccinated in Canada?
I think so. If there's a lot of ifs though, like if they engage every family doctor, dentist, and pharmacist in the country, if they can solve the storage issues, which they probably would with the Moderna and the Johnson and Johnson, which just need regular freezers and fridges, and if they can get organized enough, I think so, because there's enough doses of those three to do it. The issue is that will they do it? I don't know. I think they should be more open about this. Like, do it as an open source thing. Say where the centers are, how many volunteers needed, and start recruiting. It's not hard to get trained people how to give needles. Like, it's there's a lot of medical and paramedical and associated specialties that can do it. It's just there's 50,000 doctors in Ontario alone. There's maybe 100, 200,000 nurses, 10, 20,000 dentists. All of them can be used for something like this. Tens of thousands of pharmacists. All of them can be used for this. They just need to be told at when to get ready and plan ahead. So I wish we could see more of that and more public engagement.
Yeah, and I think to Azam's, you make a good point, Azam, because we do have the COVID alert app. You also have an app for travelers to register when they come back, but I haven't seen any communication around vaccines. The only one that I've seen was a woman that created some sort of calculator that, I don't know if either of you have seen it. You can sort of input your information and then it'll give you a timeline as to when you should technically be vaccinated. But Kaushik, do you think the government should do something like that? Like, should we not have some more of these digital tools that they provide to us?
I think that's a great idea, because like, imagine you could tie your health card and your family's health cards to your phone number, get a text alert when the vaccine is ready, and book online and everything, and then fill out a waiver. Like, when I got my shot as an emergency doctor 3 weeks ago, and I had to fill out a 10-question waiver and sign and say that I won't sue if I get a bad reaction or something like that, I guess. You can all do that online on the phones. Almost everyone has a smartphone now, and we could help the people that don't. Integrate the phone numbers with health cards, and then send out a questionnaire, hook it up to a QR code, scan the QR code when you come to the vaccine center, and then you're in and out in seconds. What I had to do when I went for my shot, so I filled out this questionnaire, I had to bring my health card, clip it on. They had to do 5 minutes of processing on a computer, and then I had to wait to get put in one of the kiosks to get the vaccine. I got my shot after getting more questions asked by the nurse, and then I waited 15 minutes while they processed my return appointment and more paperwork and a receipt, and also watch for reactions. Then I went home. So there was like a ton of employees having to do this, but I can't. And it was pretty smooth, but I can't see this scaling to 40 million people, honestly.
Right. And then
we do have Amber Alerts, and I know those are more blanket, right? But we do have like a lot of people, like probably 90% at least, have a cell phone. Like, there is a way to reach out and send a message saying, at the very least, what you can say is, hey, if target, let's say, people between 30 and 50 and say, okay, you're expected to be vaccinated between March 1st and April 15th. I'm just throwing out dates, right? Obviously, I don't know. Please reach out and say, please, 2 weeks prior, fill out this question, fill out the form. And what you can do is you can have a date set up. You can do a whole lot of work ahead of time. And if you give people we get two-factor authentication on the phone. If you give people something like a code and they just go in, you can eliminate or take care of all the paperwork before you go in, and you can speed up the process of vaccination too, right?
Oh, definitely. And this is the kind of thing we should be seeing. And I think, hopefully this discussion gets out there and we can get people to really implement this. Now is the time. It doesn't take long as well to implement it.
Mm-hmm.
I was wondering if we could also talk a little bit about, I know we're in Ontario, a little bit about schools. Like before we recorded, we were talking about, we've all got young children. Some are, newborns. My son is doing online learning. And then there was a lot of recent media coverage in the last week or so about how, at least in Ontario, the provincial government, I guess, didn't take all of the recommendations through things like sick kids report, excuse me, you may have to edit that one, whatnot. What are your thoughts on schools reopening? Because I know there may be this lost generation of socialization that's really important for kids in terms of learning and integrating and just being around other people.
I think overall, a lot of the school policy has been based around wishful thinking, which is a bad way to go. I think there was a thought initially that kids don't transmit, which is not true. For if you have kids and you're sick all the time, that's not true just on the face of it.
Yep.
You're getting a cold every month pretty much. And I see that in the hospital all the time too. So that was wishful thinking, and it drove a lot of the thinking to go back. There's a very interesting trial happening in Quebec right now, because in Quebec, parents don't have the option to do online. They're forced to send their kids in, and you get charged with truancy or child neglect if you keep your kid home. So parents sued and got questioned the government expert, who said that it's more harmful to kids that if they stay at home. But then the lawyer asked the expert, what if a grandparent or a parent dies because of the COVID that the child brought? And the expert said, then the child should be taught it's part of life, which is incredible, ridiculous and incredible. So there's been a lot of interesting thinking on that. Whether I think it's indisputable that kids' development will suffer a little bit, but the collateral damage to their parents and grandparents is incredible, as judging just by the numbers that we're seeing in hospital. And we saw huge positivity numbers in Toronto just before the school break for Christmas. So without a doubt, they do transmit. With this new variant and this new airborne variant that we think is spreading from the UK, the B117, that's going to probably be even worse. There are some interventions that could have been done in the fall, such as opening windows, really bringing class sizes down to below 15 or less, you putting in high-grade HEPA filters. But I don't think that was done anywhere on a mass scale outside of New York City, basically. So things could have been done, but as it stands now, without these kinds of interventions, it's probably not safe. And again, like I said before, we're only a couple months away from mass vaccinating the most vulnerable people in the population. So I would say wait. And I think, coming from Ontario, coming from Toronto, Toronto is a city of survivors. Like everyone who's immigrated here has survived something. Like my parents went through horrible things with partition and the wars and everything. And this is, on the grand scheme of things, this is a terrible thing to happen. But, you're dealing with a population that is tougher than people think. As politicians assume the worst. But I think, as we've seen, suicides have actually come down. If you look at the latest numbers, the population is going with the program. Almost everyone I've spoken to in my patient population is following the directions, and they're tough people, and I think they can get through this.
One other question too, just to build upon that, was I feel like there's this weird media obsession every day to document the number of cases, right? In Ontario, in Canada, globally. Is there, I know this is maybe a really dumb question, is there a reason for that? And do we really need to focus on case numbers, or is it really like, you know, how many people are in ICU, what the resourcing is reflected in the hospitals. Like, what is really the most important piece of information that we should know as sort of the general public?
I think it's pretty good actually, because it gives you an idea of how well under control things are. That other number that's really important is the test positivity number. So let's say there's, 1,000 tests and that, 100 of them are positive, that, 10% is positive. That means that the rate of COVID in your community is going up. So I think it's very useful to help plan out how you're going to conduct yourself if you're going to send your child to school, that kind of thing. So I think the case numbers and then the ICU numbers and then test percent positivity are the most important numbers.
And so hopefully we get, as we get into summer, hopefully more people are vaccinated, and I'm glad that you're very hopeful on that end, both on vaccination and the fact that people in Toronto are very resilient. So I'm glad you mentioned that. Are there any, with this new variant, and let's talk a little bit about that, do people need to take some additional measures in addition to what they've been doing? Like, I mean, already it's winter, so obviously, this concern that because it might, the virus might linger a little bit more in the air. Like so some of our audience or viewers, if they want to go out for a walk, like, how far can they go? Or is it safe to still go out for a walk? And do you still should you still keep a mask with you in those, when you're out? What are your thoughts?
So I think it's definitely safe to go out for a walk. I think it's required. It should be a requirement that you go out for a walk because that's how we stay sane. I think, maybe masking outdoors will become a thing just to prevent, if you walk by a heavy smoker, you're smelling something that's airborne. So that might be a thing, like people will have to start wearing masks outdoors even. But I think most people's weak point in going into indoor spaces, those who can work from home, who have the option, is try to cut out the grocery store if you can and try to do pickup or delivery. That's one tangible thing you can do. There's a lot of stores that really refined the process down. They've had a lot of time to practice. You just show up at your Walmart or grocery store, send a quick text, and then it's in your trunk and stuff. I've been doing delivery even before the pandemic, and the only thing that sucks about it is that the grapes you get are garbage. But other than that,
we also do Hello Fresh. I don't know if any of you do that. It's sort of like these prepared meal boxes, and those seem to work really well too. So
maybe we'll try that too.
Yeah. Or I guess you use Instacart, right? I don't know.
Yeah, Instacart can be expensive though. Like if you
that's true.
It can be pricey. Like I guess you can compare it, but all of the major chains have really good delivery options. And if you're not savvy with the apps they have on tablets or phones, they'll do phone orders too. Mm-hmm. So all of that can be done. Like that's the one big exposure most people who've been careful have. The other thing I would do is if you're working at a workplace, the Ontario guidelines are really, really far behind on this. They say they don't even need to wear masks indoors if you're 2 meters apart, which is ridiculous. Like it needs to be masking at all times indoors, focus on ventilation, cycle that air in and out. A good number is if you get one of these detectors, 700 parts per million or below is good. The atmosphere in general has about 410 parts per million CO2. So 700 means you're not breathing in someone else's air as much. My house has pretty garbage ventilation. Like I recorded 1,200 parts per million. So, wow. So a lot of houses, a lot of buildings have bad circulation. This is a holdover from the energy crisis in the 70s, where energy efficiency was the most important thing. So recycled warm but stale air is what they do. So even a building that might be newer might have bad air. Even a car. Like we've noticed in our group that in cars with more than 2 people, more than one person, the CO2 level can go up as well. So that if you're in a ride share, I would open the window. Make sure all the windows are open, you're wearing a mask, or at least some of the windows. And both the driver and yourself are wearing masks. So that's a few tangible things you can do, is basically cut out grocery run if you can. If you're in a car with another driver, open the windows and try to make your workplace safer with universal masking, even if you're spaced out, and better ventilation.
And I think this is something very important for people to understand. So thank you for mentioning that, because that breaks it down, because this is
Mm.
something that people do on a day-to-day basis, right? So I just want to move a little bit towards the future and, post-pandemic world. Do you see people starting to use masks a little bit more outdoors? So the reason I started thinking about this is I follow a baseball writer, and he writes his newsletter, and he was talking some personal stuff. And so I sort of related to it. This was the first year. So I have asthma. This is the first year in my life that I did not get bronchitis. And 2020 was the first year, and thank God for that. And one of the reasons is probably because, my exposure to people, I wasn't even outdoors as much as, before. So now I'm starting to think that, okay, I usually don't get regular flu and stuff. For me, if it's a flu, it turns into something more. And that generally happens March and December. It's something I'm sort of like a clockwork. It works. It has happened to me in the past. But going to games, going to arenas, I'm starting to think that maybe I probably will be carrying a mask more often, right? Do you think that's something that we'll start seeing a little bit more of, or do you hope that that happens?
I wonder, it's been a norm in Asia for some time that if you're sick, that you wear a mask. Are people in North America as considerate towards others? That's a question. That's a dangerous question, I think. Maybe they will be. Maybe people will be more considerate to other people. Everyone's going to have more of these masks sitting around in general. It would be nice. It would definitely protect people like you from the bronchitis, from the infections. It would protect kids from getting sick as much if children who are ill wear masks. Hard to say. A social norm is so hard to form, and I think it would be an interesting thing or a nice thing if it happens.
Mm. And maybe just to add to that, you seem to be really optimistic and hopeful. We have the vaccines are coming. You as a doctor, we feel like we're better managing sort of cases. Caseloads are coming down due to the lockdown. When do you think the pandemic will end? And then or I don't even know if it ends, like, where do you see that transition from it ending to, like, is there a new normal, or do we go back to what it used to be? Like, do we go back to how we socialized pre-pandemic?
I think by fall, I think we'll end mostly. I'll give you an example. So in my group, one of our members got sick with COVID in our emergency medicine group. She got it from a caregiver that helps care for her kids. And she got the first shot of the COVID vaccine 3 weeks before. She's only had mild illness. And same with her husband, who also was a doctor and got a shot as well. That's what's going to happen in the future, is that we'll all be vaccinated. We'll get COVID, but we'll get a cold out of it and nothing else. We'll keep getting it, as we go on. It may mutate. We may need a booster shot next year or something like that. But this virus will be with us, but it won't do much damage because we'll be vaccinated. So I think once a critical mass of people in this population, hopefully by late summer, are vaccinated, that's when I think young, healthy people will get it. Then I think effectively it will be over. International travel might be an issue because COVID the developing world is sort of last in line, unfortunately,
Mm.
because of, societal and neglect and all kinds of other complicated issues. So they effectively won't be vaccinated until next year. So it might be difficult to travel to those countries. But effectively, I think most normal life will resume by the fall, I think. I'm optimistic at least.
So
That's
one
great.
question I want to follow up on that. You mentioned that you might need a booster next year, and we'll probably find out in due course. So one of the things that, well, at least with Pfizer and Moderna, that I'm aware of, that it's a two-shot dose, right? And then the second one is a booster, 21 days. And there's been conversation around, do you do it around the same time you hold off those doses or those shots, or do you, just go with it and extend the 21-day period or whatever that period is for the second shot so that you maximize the first inoculation? What are your thoughts on that?
So your immune system, let's say you get infected with a bug, it reacts to it. You get a fever, you get sick. Your body after day 3 or 4 starts building antibodies, and then you get better. The whole reaction finishes at about 3 weeks, and that's when they time the second dose of the Pfizer. The maximum is not completely known on challenging your immune system. Some researchers I've heard discussions from say that, you know, when they test a new vaccine, sometimes they'll go to 8 to 10 weeks on it, but there's no known upper bound to it. And there's already some protection, especially if you're younger, with just the one dose. So it should still be effective with a longer interval. It's just not been tested, but likely it should work just from knowing the physiology of it. And even if you get one shot, you'll still have a significant amount of protection after about 10 to 12 days after the shot.
Okay. And the reason I ask is because, again, in society, we have so many anti-vaxxers, we have enough skepticism about vaccines. Do you think from a public policy standpoint, is that an unnecessary risk, or is it a risk that's worth taking that we can extend and delay the second shot?
I think if we can protect as many people as we can right now with the limited time that we have, I think that's probably the way to go, because we don't know, like we already saw a few nursing homes are being basically infested with that new UK variant. I think if we race to infect as many people as possible, that would probably be the way to go. Interesting, like if you look at the numbers in Ontario today, there was something like 50 deaths, and only half of them were long-term care. So it could be that vaccines are already having an effect. It used to be 100% of them were long-term care. So there's already an effect already. So, and look in Israel, you'll see a dramatic decrease in deaths above people above age 60 because they're all vaccinated now. So with just the one dose. So we're already seeing an effect. So I think they're probably correct in stretching it out. But I wouldn't do more than 8 to 12 weeks because then again, there's not much data on that.
Yeah. And so in terms of future state, you talked about how, you know, once we're all vaccinated, you know, we may get COVID again, but it'll be maybe now akin to like a cold or a flu or something like that. So do you see sort of us, the COVID vaccine being part of this vaccination that we get? You know, we get smallpox, we get, I can't think of other vaccinations right now, but they're sort of part of like if you travel or if you want to get the flu shot annually, do you think that'll be part of sort of the canon of you're going to get your COVID vaccine maybe annually or something
I
like
think
that
so.
to that effect?
I think so. Like, yeah, it's something like I don't know if people know, but like, you know, the influenza only started infecting people about 300 years ago. So ancient people did not have any concept of the flu. So it came over from birds about 200-300 years ago, probably when cities started getting huge in Europe and Asia. And this is just another crossover of one of these viruses, like, and we'll have to live with it. We get the annual flu shot. A lot of people do, at least.
Mm-hmm.
And then we'll probably get an annual COVID shot until maybe it'll mutate out of becoming harmful. There's already 4 or 5 circulating coronaviruses that give only a mild illness. But even then, like we saw 1 in a million cases, like I've seen it myself, where people get life-threatening lung and heart damage from a random virus. Nobody knows why it happens. You just pick it up accidentally. You see a 25-year-old and their heart is like an 80-year-old's heart. Nobody knows why it happens, but they probably had some kind of virus like this, but it just happened really rarely to these people. COVID was just the virus where it happens more commonly, unfortunately.
Mm. And I guess one last question for me in terms of future state as you know, part of the podcast, like what are some of the things you think you've learned as a healthcare professional, as an emergency doctor, that in the future will do better when it comes to protecting ourselves, maybe from a pandemic, maybe societal, social norms? Like, are there things that you've taken away from this time and go, this is what we really need to change moving forward?
Or even what governments can do to protect us, right? So now we know. Everyone thinks that something like this will never happen until it actually happens, right?
Yeah.
So the desire to plan isn't that great.
It's shocking. Like, and I'll go back to, you know, the 1 year ago today, right? We in our hospital started planning. We started saying, you know, we got to do this. And I asked at a meeting, you know, where is our supply of N95 secure? And they said, yeah, we have a giant stockpile. Nobody had checked and they all expired, right? Nobody knew. So fact is, like, we all assumed on the front lines that the higher ups knew what they were doing, right? And that was the wrong assumption to make. I think everyone in every sector of society should always keep an eye out for big threats like this. the big threats I think are coming beyond this will be things like the environment or rapid technologic stuff. What I think we need more science literate people at the top decision making tables. Right now, we saw from that Global Mail article recently that at the top of our public health agency was bureaucrats, and most bureaucrats are recruited from legal or arts fields, and they didn't understand a lot of the warnings that were coming their way when it came to this virus. Um, there was genuine shock whenever I and groups of us engaged with the government about what was happening. So none of this should have been a surprise to them. And if you look at the Asian countries that have done well, all of them have more science literate people at the top. In Taiwan, in South Korea, in Hong Kong, like all of these countries, there's a much more greater tradition of people with that education and training. So that's one takeaway, I think, is that have a broader base of of education and specialization at the top tables to really look at this. And I think as the other thing is, Canada as a country has been used to relying on the US to solve all the big problems. And we've learned that that's not always going to happen when the US itself drops the ball, right? So this is Canada as a country, and a lot of small countries too, need to take more responsibility for their own affairs and their own destiny in a way. So I think that's one important thing that we learned is that we've got to work with other countries better. We got to be more proactive, I think.
I think those are probably appropriate words for us to end our conversation. Kashyap, this was a very enlightening interview.
It was great.
Yeah, really appreciate your time. Before we go, one question we ask all our guests is, obviously we've been indoors for such a long period of time. Is there any book that you've read recently that you would recommend, any show or a movie you've watched? And secondly, is there anything new that you've acquired during the pandemic? Any new skill or a hobby?
Okay. Book-wise, I just read this book called The Ministry for the Future. I think his name is Kim Stanley Robinson. It's a book about 30 years, 20, 30 years from now when climate change is really biting, and then the UN sets up a ministry for the future to try to fight it. And it has a lot of really interesting ideas, a little bit too Marxist maybe, like because they get they start killing off their enemies like good Marxists do, but has a lot of interesting ideas to fight climate change. And it's really worth the read. And I think it's sort of made me more attuned to the idea that now is the time when we need to start looking into it. That's probably going to be the next crisis for sure. And one thing I learned, I think, is there's a lot of really good tools to help get organized for sort of advocating for change. A lot of great tools, including things like Slack and Google Docs and Zoom, even just to organize it. Like every individual is able to productively work with other people, even in this time, even more productive now without having to meet in person like we did. And I hope that's something that carries on, and then really, really change the agenda of government and the media if you sort of get that right timing with your message and it resonates with just the right people at the right time. So that's one thing I learned as well, is that how to effectively organize using the tools that you have right now.
That's great. Well, thank you very much. That was very helpful. And I hope we get quite a large audience to listen to you. And you've been really good in terms of breaking down a lot of the information that we really need to know about what's going on with the pandemic. So
well, I'm happy to be here. And thanks for the opportunity. Thank you.
Thank you so much. All right.
Have a great day.
Have a great day.
Bye, guys. Bye.
Bye. We hope you enjoyed our episode. Your feedback is always appreciated. You can email us at futureof19@gmail.com. You can also visit our website at www.ftrof.com, as well as follow us on Twitter, Instagram, and Facebook at futureof19. You can subscribe to our YouTube channel, The Future Of. Please leave us your comments about what you liked, what you didn't, and what would you like to focus on for future episodes. We'd love to hear from you. And lastly, if you are enjoying our episodes, if you enjoyed Season 1, looking forward to Season 2, please consider supporting us at Patreon at www.patreon.com/futureof19. Thank you very much for your support and have yourself a wonderful day.